All right, what's up guys? Welcome back for episode 4. We're gonna call this section 1 because all these videos so far have focused on the upper cervical region. We threw the TMJ in there as well. Before we get into the self-treatment stuff, I wanna show you guys some pictures out of this Treatment Simon's book. This is a fantastic book. The illustrations really, when you see them, you immediately are like, yep, that's it right there. So I've got some pictures about suboccipitals, and it'll show there'll be an X. That's where the trigger point is, and sidebar, a trigger point's really just a muscle knot. When you put pressure on it, it's gonna hurt in that spot, and that's what the X is showing. But then there's kind of like a pain referral pattern that's kind of like red dots. It's hard to explain. You'll see when I show them. But that's where the pain will refer to. So this can be huge in really figuring out the symptoms and what the root cause of them is. So I got a picture here. Let's go ahead and check out the suboccipitals first, and it's got, so there's 2 spots. And if you remember back to the previous videos, there's kind of 2 muscles that are closer to the midline, and then there are the obliques, and it's showing a trigger point in the inferior oblique, and we're going to talk about how to find that, and then back closer to the midline, and don't worry about what that muscle is called. So you can see the X's, and then you see where that pain referral pattern is. Let's move on through the muscles, then we'll circle back to all of them. So then in this one, they're showing trigger points in the masseter, and again, where's that trigger point refer pain to? And then the next one here, the pterygoid, kind of refers some pain forward towards your cheekbone. And then we've got the temporalis is really interesting. You can see how that will send pain down towards your teeth. I mean, that's kind of a bizarre thing, but I mean, I've experienced this. Put pressure on somebody's temporalis and they feel that pain come down towards the top row of their teeth. So it's really crazy stuff, guys, but it can be life-changing for people. I think in the first video I mentioned quickly about a patient that we had in Clarksville that had very intense pain, and her description was that it was deep in her ear canal, and she had all these ear, nose, and throat guys checking her out, all kinds of different professionals looking at her, and they weren't able to find anything. And this is to credit to the folks I was working with at the time that gave me advice and things to check, and we found trigger points, and we got that pain to go away. So that was really a cool experience. So if you remember back to episode 2, I believe, we talked about how to find your C1 and your C2 vertebrae. So let's start with C1 again. We'll just go through that again quickly. If you're just below, and I got big ears, so just below and slightly behind your ear for me, that's the transverse process of the C1 vertebrae, okay? And if you'll also remember that oblique, that inferior oblique, and I can feel mine because it's pretty tight, you trace that back, and there's your C2, and remember, if you come down off the base of your skull, the C2 is the first one you're gonna find. So now you got those landmarks, and you wanna put your lacrosse ball right in between those, and then you're on that oblique, and simply to come over to where that other trigger point was shown, you're just gonna cruise kind of back towards the midline. As long as you're not on your skull and you're above the C2, and you're gonna be, guys, there are other muscles that we didn't talk about here. There are multiple layers of muscles on the back of our neck there, but the suboccipitals, you won't question if you found them. When they're tight, they will let you know. So you're gonna take the lacrosse ball and press it between that area and the wall. And for me, it really just feels tight, like I know I'm in the right place. I don't have any pain referral, but move around a little bit and see what you find, okay? So, and people are gonna ask, how long do I stay on there? I mean, you got to get a trigger point release. So what's happening with a true trigger point release is with the pressure, there's less perfusion of blood to that area, which means less oxygen. The muscle needs that to stay in this contracted state. So you've got to shut that off long enough to where the muscle, you force it to relax. So how long is that? I mean, we're talking 45, 60 plus seconds. Okay, so maybe not the first time you do it do you stay in there that long. And that also doesn't mean with less time you're gonna get nothing out of it. So you gotta find, what's your tolerance for this, and what you want, and this is true of any treatment, as little as you need for the biggest benefit. So the good thing is you can always check how it's going, and I forgot, this should be at the beginning. Good ways to check your mobility and flexibility of the 0-1 joint. Sorry, the mobility of the 0-1 joint and the flexibility of those suboccipitals that are closer to the midline. With a full rotation, you've taken up all the slack in the lower cervical segments. So the only place you can bring your chin down from is the 0-1. So that can be, let's say you're treating more the muscles closer to the midline with the ball, that can be your test, retest. So before you get started, rotate, bring your chin down, and if you can get a couple fingers between your chin and your collarbone, you need some work. So you do that first, treat a little bit, double check it, and definitely do both sides. Now, if you're thinking more like, I've got a rotational issue, so you're talking about the 1-2 segment, you're probably gonna be more on the oblique. The superior oblique is, it's hard to get up in there, so let's not worry about that too much. The inferior is gonna be a lot easier to find, and I think you'll get pretty good bang for buck out of it. If you're trying to check that 1-2 joint, and this is kind of hard to do on yourself, you can have somebody else there that can say, oh buddy, you can't turn to the right. So now if you're coming all the way down chin to chest, and again, you're taking up all the slack in the lower cervical segments, then you're gonna rotate, and the only place you can rotate from is that 1-2 joint. So chin comes down, rotate, rotate. Now, another check, and this can help you determine if it's joint stiffness or more of a muscular limitation. And there's so many other things to consider here, but you see how these two tests compare, and it can help you identify what the problem is. So similar, you're gonna tilt, and then see, I can't turn to the right, but here I can turn to the right. So it's not my C1-2 joint that's not moving, it's a muscular limitation. So this should be my best friend, really, and I should be on the right side, not the left side, while I'm doing this demonstration. So that's getting a little nitty gritty. Do you want to smash a lacrosse ball on your head or on your face? Probably not, so let's put him away. But what you can do, so let's start with the masseter, and just bite down, and you'll feel it. So I'm about, sorry guys, still kind of beard season out there. Find the angle of your jaw and come straight forward from that, and then bite down, and you'll feel that masseter kind of swell underneath your fingers. Now move around, just kind of small circles, and you may find a trigger point in the masseter is going to feel kind of like there's a little pebble right there. And again, this is within your tolerance. Like that hurts pretty good. I chew too much gum. That sucker's knotted up. And it doesn't, I don't have any pain referral with this either. But you know, everybody's a little bit different. It hurts pretty bad, and my bite feels better after, I didn't do this just now, but I've done it off camera. My bite feels better after I get that out of there. And you know, I'm just digging in with a couple fingers for about 30 seconds and then doing some lateral deviation of the jaw, do some opening, closing. And that kind of leads me to a good point. And this is true for any treatment, any body part. If you get a trigger point release, now you've kind of reset those muscle fibers. You must use them after that, or they're eventually going to go back to where they were. And you know, the way I talk to patients about this is, so if our plan for that day is to really get into a muscle, like maybe put some heat on there for 6, 8, 10 minutes first, because that you're going to be able to tolerate some pressure a lot better if the muscle's warmed up. If you just go in there cold and you're sticking elbows into stuff or smashing things with lacrosse balls, it's going to hurt so much you're not going to be able to stay in there long enough to be effective. So maybe you put some heat on there, then you come in after that with the pressure, lacrosse ball, whatever mechanism you're using, massage gun even. So that's phase 2. Then, you know, throw a light, keyword light stretch in there, just to lengthen the fibers a little bit. And then you absolutely have to retrain the muscle. It all fits together nicely, but that's by far the most important part. So let's stick here because we're talking about the masseter. So let's say you get a trigger point release there, and no, you don't have to put heat on your face. You get a good trigger point release there, and you know, rewind if you did have some deviation with opening, closing. Unfortunately, that's something you got to practice, and you'll feel like you have too much freedom of movement and no control after a trigger point release, whether it be here or in any other muscle in your body. So you've got to practice the movement, and that's more of what we would call motor control rather than true strengthening. But you got to be able to control something before you can work on getting it stronger. So that's layer 1. So simply working that path. And for those that have subluxation of the disc in the TMJ, your goal, like a lot of times those folks are getting too much range of motion as far as opening. So you've got to shorten that and just practice a narrower range of motion of open close. And along with that, you can try to control against any deviation of the jaw. So pterygoid, kind of start right even with your ear and move forward towards your cheekbone. This, I can put an image up there. This little bone right here, right up underneath that. So the pterygoid's a little bit deeper than the masseter, but get some pressure on that if you've got these kinds of issues, and see if you have any familiar discomfort or yeah, I mean, even that little bit helped me move somewhat better. A lot of this stuff, you don't realize how tight it is until you loosen it up. So even if you don't think you have a problem, try some of this stuff out and see what you can get out of it. Pterygoid, again, it has some fibers that attach in onto that disc. So that one can do a lot of good for people with that issue. All right, what do we got next? Temporalis. So it's a very broad muscle, and it kind of fans out on the side of our head there. And same way we found the masseter, just a light bite down, and you'll feel it kind of flex under your fingers. And you don't have to be super heavy-handed. You gotta have a little bit of pressure. But just kind of and just keep that picture in your mind of where that is and move through that muscle and see if you find any tender spots, and especially if those tender spots refer pain like we saw in the picture. And I can put all these back up again, or you can rewind in the video. So what else we got? We talked suboccipitals, we talked masseter, we talked pterygoid, we talked temporalis. So let's say you've gotten some good trigger point release to temporalis, masseter, pterygoids, and we talked a little bit about controlled opening, closing. Another thing you can do is an isometric, and there's a few different directions you can do it in. Resisted opening, so if my hand wasn't there, my mouth would open, but I'm just gonna press down for about 5 seconds, and I would do 10 reps, and I would do this a few times a day. You can also work on lateral isometrics, so blocking kind of the side of your jaw there. And you may notice as you do that, as I just did, that I couldn't push as hard to my left side. So is that, yeah, that pterygoid was pretty tight. But that's just another thing you can do to help reset those muscle fibers after you get the release. That's all muscular stuff. So let's kind of go back and talk about the joints in the upper cervical region again. Now, this is just called fist traction. If given as a home exercise program, part of a home exercise program or anything like that. And that's, you use your fist to block your chin, and then the other hand is lifting up and slightly forward, and that's to gap that 0-1 joint. And you're kind of using this fist as a fulcrum to gap that joint, and it actually does work. So that's a good C01. Also, just the test that I was talking about earlier, that can be, you can make that an exercise. So if you're just simply like those suboccipitals with the lacrosse ball, and because you're rotating, you're going to address C1, 2 a little bit as well, but this is more like trying to lengthen all that stuff in the back, suboccipitals and 0-1 joint together. And we haven't talked about deep neck flexor activation yet, so let's do it now. Okay, so you got a good release of your suboccipitals, you did a little bit of traction, things are moving better, but you still got to retrain these deep neck flexors in the front. Now that you actually have opportunity for movement, it's a great time to do that. So as you can see in the video here, just laying flat on the table here, you can do this on the floor at home. I wouldn't do it on the bed. You need a little bit firmer of a surface so you can kind of feel what you're doing. And it looks very simple, but it can take quite a bit of control. And what you want to think about is it's just a subtle rotation, because again, we want to retrain around that C01 joint so that the suboccipitals don't just get tight again, and so that joint doesn't just stiffen back up on us. This is how we do it. So think you're nodding and you're lengthening the back of your head. These muscles are small, they're deep, you're not necessarily going to feel any kind of burn or anything like that. You just really want to focus on correct movement, which is that nod, and not kicking everything else on here. Now, when I got to that point where I was actually lifting my head up off the table, yeah, a lot of other stuff has to kick on. And the key with that is just to keep the correct position, like keep your chin back as you lift up. And you can gradually progress this. All right, thanks for joining for episode 4. That was kind of a lot. Let me know if you got any questions. Shoot me a message on Instagram or YouTube or however you please. The next section is gonna be about the rest of the cervical segments and the upper thoracic segments. So look for the first one of those in about a week. Have a good one, guys.